We now have the bill. We have the proposal coming through Republicans. You've looked at it. What do you make of it?
It's sad. It's an abomination for a couple of reasons. Number one, a lot of people are going to get hurt. They tend to be low-income people, children. A lot of people who have private health insurance will no longer have coverage or it'll cost too much. A lot of people are going to get hurt. Second, we need to be here. When I was chairman of the Finance Committee, we worked very hard on a nonpartisan basis, Republicans and Democrats, to put together a health care bill, and we worked together. But at the very end, unfortunately, the Republicans became very partisan and political. We did not work on public policy, and they fell apart because Republicans all voted against it. Cancer or heart attacks hits people irrespective of whether you're a Republican or a Democrat. It doesn't matter. We should be working together to get this put together, and there are ways we can do so. That's the second sad part of this.
So look, let's talk about the sad and the abomination. We had Representative Bouchon on earlier, Republican representative, who is partly responsible for this bill. And he said, in fact, we're going to have more people insured because of this bill, because we're going to give healthy tax credits to all of these people. And in fact, they'll be able to participate in the private insurance market. What do you make of that?
Well, first, a lot of people will drop out under the so-called Medicaid expansion. That is, the bill tends to fall back on low-income coverage under Medicaid. So fewer people will have health insurance, and that includes children. But second, the tax credits that are talked about here will replace, allegedly, some of the other benefits that were in the current law. Those tax credits that are proposed will be much lower. They'll make it much harder for a person to buy health insurance. We're talking here about people who don't work for a company, but rather people who are self-employed or who, for whatever reason, need to buy insurance by themselves. They're going to get hurt.
So, Mr. Investor, as President Trump has said, and others have said, Obamacare itself was not going flawlessly. There were a lot of insurance companies pulling back out of the private markets. It was really troubled. So didn't there need to be some sort of fix, such as tax credits here?
Well, clearly, Obamacare, or the bill we wrote, it's not perfect, but it was good. It helped provide a lot of coverage for a lot of people. It was a good bill. There are flaws. What are some of the flaws? Well, one is I think the current law is a little bit too inflexible. We can be more flexible in formularies and under Medicaid provisions. There's no question about it. We need to work together. But that's what this all comes down to, is working together to fix some of those flaws. I might add that in the last three years, unfortunately, the Republican Party, the majority party, has cut back on a lot of provisions in health care policy in the ACA, which make it difficult for insurance companies to cover people. So it's kind of worked on a way to prevent the law from working very well. Look, it all comes down to working together. This is hard work. This is complicated. But again, illness doesn't care whether it's a Republican or a Democrat. It doesn't matter. We all work together. Let's sit down together and write a bill, not make it political, but sit down and figure out where it needs help. And there are a lot of areas where the bill does need to be improved, no question.
Well, and a critical question about how much working together has to happen is whether they need 51 votes or 60 votes. And that has to do with the reconciliation mechanism. That depends on whether this bill actually will affect the amount of money going to the U.S. Treasury. Do you have a sense about whether when they score this thing, it's going to be revenue neutral?
Well, the so-called reconciliation process that you mentioned has to do with funding, and there are other parts of the Affordable Care Act which do not have to do with funding. They'll have to be dealt with separately. I think the score that the CBO is going to come up with is going to be one that's going to be very difficult to deal with, because my judgment is that probably the score down the road is going to mean it's going to cost more, not less. Why is that? Because people who don't get health care are going to need health care later when they go to the emergency room, and that's going to cost the American people even more.
And finally, Mr. Ambassador, as you said, you'd like this to be nonpartisan. In fact, Obamacare got to be partisan, and this will no doubt be partisan. Tell us about the political ramifications potentially for the Republicans if this bill, as it's now written, is enacted.
Well, it's, you know, you get what you pay for. If it goes around, it comes around. The other party, Republican Party, made it very political back in 09 and 10 and blamed the Democrats all Republicans voted against it, called it Obamacare, tried to saddle it on the president and on Democrats. Well, now it's reversed. The Republicans now own it. It is Trump care. They hate Obamacare so much they want to do their own. But I got to tell you, when they work to try to pass Trump care, that is a Republican bill, they're going to find this is so complicated that the only solution is trying to find a way to work together. Because if they make it political, as they are, they're going to own it. And in the meantime, a lot of people are going to get hurt, and they're going to rue the day that they decided that they wanted to take it over on their bill rather than work together.